Some people are more prone to common cold. Around 25% of population have around 6 episodes of common cold per year. In children, this number can reach 8 episodes per year, which is considered normal. You can improve your immune system function. And for example, if you have 5 episodes of common cold per year, you can realistically reduce it up to 2 episodes of common cold. First and most important thing you can do is regular sleep. You should sleep at least 7 hours per night. This is essential to produce and train immune system cells like T lymphocytes and natural killers and B cells. This process happens mainly at night, not during daytime rest. People who sleep less than 6 hours per day have about 4 times higher risk of catching a common cold after viral exposure. Sleeping more after you already sick is not effective and is not enough and does not compensate for prior sleep. Second most crucial factor is nasal breathing, not mouth breathing. The nose filters, warms and humidifies air. It also produces nitric oxide, a gas which has antiviral action that reduces viral replication in the airways. Chronic mouth breathing is associated with around 2-fold higher risk of common cold. People who are lecturers, teachers, and speakers have higher risk of common cold because prolonged speaking leads to forced mouth breathing and it increases exposure to cold air, which weakens airway defense. In this situation, it helps to consciously return to nasal breathing between speaking episodes, use warm fluids before and after speaking, and avoid speaking in cold environments without neck protection. Another important factor is protein-rich nutrition, because proteins are essential for antibody production. Egg, fish, lean meat, and fermented dairy products such as yogurt and kefir and legumes are reliable protein sources and support immune system function. Regular moderate exercise is also important. Around 45 minutes per day is considered ideal, such as brisk walking or jogging. Reduces respiratory infection risk around 40%, but overexertion is not recommended. Repeated endurance sessions longer than 90 minutes increases this vulnerability. Also, common cold risk increases if you are sleep deprived and exercise, or if you are on calorie deficit and exercise, so it's not favorable at this case. Thermal maintenance is important, is another key factor, especially for hands, feet, and neck, because cold exposure to this area causes reflux vasoconstriction. Small blood vessels are constricted and blood flow is reduced and immune system cell delivery is worsened. That's why your hands and feet are major thermoregulatory sensors, and cooling them can trigger vasoconstriction. And it partially explains why colder climates and winter seasons correlate with a high frequency of common cold. Hygiene also matters, especially hand washing and face touching control. Hands should be washed after returning home, before eating, and after public transport use. Soap and water for 20 seconds usually is sufficient. Obsessive washing is unnecessary. People touch their face around 30 times per hour unconsciously. Avoid touching eyes, nose, and mouth, which are direct viral entry points. Chronic calorie restriction is another overlooked factor. Being on a diet or sustained calorie deficit can worsen immune function around 20%. Even moderate energy deficiency suppress antibody production and immune system response. Poor oral hygiene is also increased risk of respiratory infections around 30%. This includes skipping toothbrushing, chronic gum bleeding, untreated cavities, persistent bad breath from bacterial overgrowth, and dental plaque accumulation. The mouth can act as a bacterial reservoir that worsens upper and lower respiratory infections. Early rest is also important. It reduces workload immediately. After symptoms appear, you should prioritize sleep and avoid intense training, keep warm and eat adequately. Light movement is good. You can gentle walking, it supports circulation, but intense exercise is not recommended during this phase. Smoking is another strongest reversible immune system suppressor. It weakens immunity more than poor diet or sleep loss, and it has similar effect as a chronic severe stress. Smoking damages bronchial epithelium, paralyzes ciliary function, and cause chronic airway inflammation. Cough often lasts more than 3 weeks in each episode. After smoking cessation, improvement starts quickly. Within 2 weeks, cough frequency often decreases. After 2 months, immune function improves noticeably. After 6 months, people usually experience significant fewer common cold episodes. If you want short-term support, simple home remedies: warm drink with honey, ginger, and lemon. Use cup of warm water, not hotter than 50 degrees Celsius, because high temperature denaturates active compounds. Add 1 teaspoon of honey. It does not add important calories, but add benefits for throat. It's important for throat mucosa. It reduces cough reflex, and it can reduce night cough around 60% in viral respiratory infections. And add fresh ginger, around 1 or 2 grams. Ginger has anti-inflammatory effect, anti-irritant effect, and antimicrobial effect also. Add fresh lemon, around 10 milliliters. It gives mild epithelial support and small vitamin C contribution. This drink does not kill viruses, but it supports local defense systems, improves sleep quality, and reduces irritation. Another important remedy is garlic, because garlic has immune stimulating effect. Use 2 fresh garlic cloves, 1 teaspoon of honey, and 1 teaspoon of extra virgin olive oil. Crush the garlic and let it stand around 10 minutes. It allows allicin formation. Mix it with water and olive oil, then swallow. Honey improves tolerance, olive oil stabilizes allicin and supports absorption. Garlic sulfur compounds have immune stimulating and antiviral effects, also for prevent excessive immune overreaction. Use it 2 times per week for prevention and 3 times per week if you already have common cold signs. And preferably it use in cyclic. It means you can use it for 3 weeks and then rest for 2 weeks and then continue. And for long-term everyday support, most important home remedy is kefir, plain yogurt or matsoni, around 200 milliliters per day, and combine with 1 teaspoon of oats and 1 teaspoon of ground flaxseed and 1 teaspoon of chia seeds. So at this case, you have combination of prebiotics and probiotics. Prebiotics are important to grow beneficial bacteria in the gut, and probiotics are beneficial bacteria itself. And our immune system highly dependent on our gut health. That's why dairy fermented products are one of the strongest evidenced long-term support for our immune system function.